Hi, I'm Dr. J. Michael Bennett. Today we're going to talk about second opinions. This is primarily for the patient who is really on the fence on whether or not they want surgery, whether they think it's the best thing for them at that time in their life, whether they think they can cooperate with the rehab afterwards. In our practice here, we encourage second opinions. If there's any questions regarding our treatments, if there's any questions regarding the post-operative recovery or rehabilitation, I encourage our patients to ask for second opinions. Here we follow the standard of care, and I believe that if you do get a second opinion, then those doctors will agree with the process that you're offering them. If you are a patient who's working with a doctor and they're suggesting surgery, you have to understand that there is always an option, particularly in orthopedic surgery. Unless it is a broken bone or a broken bone that's open, meaning exposed to the air, then there's nothing that is emergent about orthopedics unless it's a neurovascular issue, meaning blood, nerve, or bone is exposed and at risk for getting an infection. Then you need to obviously do that quickly. Or if the bone is broken, then you need to address it quickly. But when it comes to sports medicine or tendon tears or ligament tears, if there's any question about it, you should have the option of doing nothing or fixing it electively. It is an elective procedure. Most patients, if they're active, will typically want to have the surgical intervention to get back to their previous activities. However, there is a subset of the population that's just perfectly happy not having surgery at all, which is fine. They just need to understand the risks associated with non-operative management, which could be a number of things. It could be weakness, it could be cramping, it could be stiffness, it could be lack of motion, it could be aching pain and numbness and tingling long term. There's a number of possibilities out there in regards to what are the risks associated with non-operative management. But that being said, there's always the risk associated with surgery. And the risk of surgery being infection, same thing, being stiffness, having your bones heal in the wrong position, heal in an angulated position, having your bones not heal, having the hardware not take. There's a number of possible complications involved with surgery as well. Fortunately, in medicine, nothing is a guarantee. But that being said, your surgeon should go through each option with you and explain thoroughly what the risks, what the benefits, and what the options are. Typically, if you have a fracture and you cannot walk, and ambulation is the key to preventing a pneumonia or preventing a blood clot in your legs, then obviously surgery is indicated as soon as possible to get you moving. If you have a tendon tear or a rotator cuff tear and you have some aches and pains, particularly at night or with overhead activities, many times you can try therapy or you can try an injection and think about it. You can research it. I'd highly recommend, if you do research, particularly on the internet, to research all orthopedic issues at a reputable site such as the American Board of Orthopedic Surgery or the American Academy of Orthopedic Sports Medicine. Either of those websites have, or even the American Academy of Orthopedic Surgery, all those websites have access to sites that can explain the standard of care regarding your particular ailment. And your surgeon should go over that with you. So, if you have any questions or any hesitations regarding your treatment, please consider a second opinion. And make sure that you're comfortable and confident about the decision you make and that you and your surgeon are on the same page, particularly regarding post-operative recovery, physical therapy, return to play, and resumption of normal activities. If you have any questions regarding this, please contact my office. I'm Dr. J. Michael Bennett. Thank you.